If you want to get busier, in your practice, help patients become decay free.
Hello and welcome to Mommy Dentist and Business Podcast. I'm your host, Dr. Grace Young. Welcome back, everybody, and thank you for being our number ones and always ranking us super high on the dentalwoo.podcast.org organization. And we really love being fan favorite. It's truly an honor to spread dental knowledge and bring you amazing speakers. Thank you for being part of our community. Today, I'm very excited to introduce our guest speaker, Dr. Kim Kutsch, trailblazing dentist, inventor, educator, and CEO of Oral BioTech, makers of CariFree. Welcome to the show.
Hey, thanks, Grace. It's great to be here with you. And kudos to you on your podcast.
Thank you. Thank you. It's a labor of love.
Oh yeah.
But we love it just as much as you love CariFree. I would love for the audience to get to know you and what you've done and accomplished. If you don't mind sharing a little bit about yourself and how you got to where you are today, that would be amazing.
Yeah, Grace. Well, I think I trace my roots back to I was raised on a farm here in Albany, Oregon, and always kind of was raised with the mindset of, questioning, being curious. I was very curious as a child, and so that led me through to where I'm at today. I went to dental school. I'd always wanted my origin story. I decided at age 6 that I wanted to be a dentist.
Wow.
I loved going to the dental office in spite of the fact I had a lot of cavities.
Really?
Came out of dentistry, and I think carried that curiosity with me through my career of like, how can we do this better? And I think I became a pioneer in lasers. I've looked at a lot of different technologies, and then I started creating products, inventing products. I built 7 different dental companies over my career, and my last and current company is Oral BioTech, of course. But just led me to continue to look for how can we get better? How can we provide better outcomes for patients? How can we help them get healthy? So that's always been my focus, is really been patient-centered in terms of how can I get these folks healthy? And so that kind of led me to where I'm at today in this serendipitous route.
That's such a great story. It sounds like you are a serial entrepreneur and inventor. Very, very neat. And I'm sure we could do a whole nother podcast just on entrepreneurship and what that looks like and that entails. But I'm going to stick to the questions. My way out. So here we go. My next question is, was there a moment early in your research or clinical experience when you realized that we, as a dental profession, were managing decay the wrong way, that it's actually a bacterial disease and not a drilling problem?
Yeah, and Grace, I'm a little embarrassed to say it wasn't early in my career. It was really after about 20 years in practice. And, I practiced in a small town, my hometown. My parents, being farmers, were prominent in agriculture and the industry here. They were well known. So my patients, when I came back home, were literally people who had known me my entire life. So they were family and friends and people that I deeply cared about. I was frustrated. If you stay in one place and one practice long enough, you see your own work fail. And and that's a humbling experience. And I was frustrated I was doing everything I've been trained to do. I was investigating all these different technologies, trying to just improve our outcomes, and I wasn't making any progress. And I woke up, my patients kept getting cavities, and they were doing what I was asking them to do, teaching, and I woke up one morning and I just realized, like, this doesn't work. Like what I was taught doesn't work, because if it worked, it would work. And patients would stop getting cavities, and they didn't. And they were frustrated. I was frustrated. And so I really went back to, Rilla Christensen said we were missing something. And I really went back to what piece is missing here. And so that was about in the late 90s. And I tried to resolve it with, lasers and air abrasion and minimally invasive dentistry. I became an expert in that topic. And it just didn't seem to make a difference in terms of our, caries rate. And so that's when I went back to the drawing board and was like, okay, what's missing? And I had an opportunity to spend time. I was teaching down in Australia, an opportunity to spend time with Ian No, who is also an expert in minimally invasive care. And he just kept asking me one day, Kim, how do you diagnose dental caries? And I would describe to him how, I was using a microscope, a caries detection dye, Sharp Explorer, digital radiographs, and he goes, yeah, okay, I get that, Kim. That's how you identify cavities, but how do you diagnose dental caries? And I was really confused by that question. And finally, he said, it's like a disease, right? It is a disease. How do we diagnose the disease? And for me, the light went on. And it was
Mm.
like, this is what we're missing. We've been treating cavities and we've missed what was causing the cavities. And I think, so that was in 2000. I came back to the States after that trip and I contacted John Featherstone. I was like, I get it. It's a disease. How do we do this? And his response was, well, no, nobody really knows how to do that. We just know that we should be doing it that way, right? And so I'll never forget. I told John, then I'm going to figure it out, right? I went back to my practice and it's like, okay, now my task, my challenge is how do we
Mhm.
figure out how to treat this successfully as a disease? So that's been about 25 years ago, and that just put me on the path that I'm at today.
Wow. It's interesting because for me, as a pediatric dentist, as you're speaking, I'm listening and it's drawing up my own experiences with children and
Hmm.
parents. And when we treat the whole family, we see kids that have one, two, three, four, five, six siblings. And there's always one kid in the family that is crying because they never make the no cavity club, no matter
Right.
what. And
Yeah.
it's frustrating. So I did away with the no cavity club, but it is frustrating, right? How do we prevent caries from happening, especially not just adults, but children too? And I think that it's for each child that has to endure it, it is a sad experience for them, right? And then for adults, frustrating because they can just look at a piece of cake and get a cavity.
And I think until I started doing this whole caries risk assessment approach to care, I didn't really appreciate the emotional baggage, the shame, the frustration that comes with this disease. And I mean, I literally had adults break down and start crying as I was,
Mm,
asking them how it affected their life, and
yeah,
I didn't really understand that, and it is frustrating. And I think, the challenge is, we we as dentists were trained to fix cavities. I mean, that's what we're
right,
trained to do, right?
right.
And so we see a patient and we automatically look at how many cavities do they have and how am I going to, I mean, in your brain, you're already starting to like calculate how are we going to restore this mouth? And the question we should be asking is not how many cavities do they have? The question we need to ask is why do they have cavities? Because
Mm,
if I can figure out correctly why that kid has cavities and never gets to join your club, I can help that kid and that family become decay free, right? And
mm-hmm.
you got to ask those questions, and we're just not trained to do that. And so I think that's the biggest hurdle for us. It's such a dramatic change of mindset.
Right.
Walking in and seeing that and going, not what, but why?
Why?
Ask why, right?
So I'm going to ask you why. Why do you think so many practices still struggle to fully implement asking the why, the caries risk assessment, like the
Right.
everyday,
I
like,
think it's a challenge. I mean, it's a huge shift in mindset. Like it's a huge paradigm shift in terms of how you approach care. And so everybody in your practice has to be on board. Like I literally
mm,
struggled. I mean, this was my goal, my mission in life, and I struggled to get this implemented in my own practice 25 years ago. But I had two hygienists that got it. And they started seeing the results after a couple of years. And
mhm.
then it was like, we were most effective in groups of teams of three. And so I took the two of them out to lunch and we got together and I said, okay, how do we get the entire practice to get this, right? How do we as a group? And that really um, helped us establish that. But the whole infrastructure in our profession isn't set up for this, right? So like our hygiene appointment hour, God, we've overloaded that with too many procedures. That whole system needs to be modified and changed, right?
Yeah.
But it's our billing system, it's the patient expectation, awareness, and education, and it's the mindset of the dentist. So the whole infrastructure that we have in our profession doesn't support it. Like if you got paid $100 every time you filled out submitted a caries risk assessment form, I guarantee you that would happen more often, right? If the insurance companies were saying it was part of our infrastructure, and it's becoming that slowly, but it would be integrated as part of our daily care, and then people will start to see it that way, and it would get implemented. But the first hurdle of like It changes every system in the practice. You got to have time to be able to educate the patients. And our whole system isn't set up. We don't get reimbursed for educating people. I mean, it's like the whole system is set up to provide restorative care or surgical care of some manner. Everything is all based around doing that and not about your care knowledge and skill and judgment. And so that's what needs to change. And that's probably a generational thing. That's probably going to take a generation or two for us to make that change. But I see it happening in medicine as well. People are starting to back up and go, well, wait a minute. Rather than give you this medication for diabetes, what's causing your diabetes? And let's focus on that. And so I think as people become more aware of and accepting of backing up and looking at risk assessment and what are the risks that are driving the disease and treating that, I think we'll eventually see change in our profession.
I think so. Finding the root cause, treating the root cause rather than fixing the symptoms, like you said, is really what we're trying to do and help with our patients and their frustration, ultimately. What do you think is the simplest first step that practices and dentists and hygienists can take if you gave like a step-by-step process? Like, what is the first thing that they need to do to go towards implementing caries risk assessment?
Yeah, I mean, the very first step is to have a risk assessment form. And, obviously the form is a little different for adults or, versus children, right? Because there's some risks that are fairly unique to children as, they're under age 5 and developing. But the very first part is to have, find a caries risk assessment form that you're comfortable with. Recommend my form. It's free and available. You can get it on the CariFree website. I'm happy to share that with you. But I spent 25 years refining and perfecting that to make it simple. When we first started doing this, I was on the first Canberra Coalition Committee and as the lone clinician, and we made it way too complicated. It needs to be simple. It needs to be out of the hygiene operatory, and it needs to have patients self-report their symptoms. That starts the conversation at a whole different level. But then implementing that risk assessment form will slowly shift and incorporate that whole mentality in your practice. And I have practices that started the next day giving it to everybody. I had practices that like only focused on new patients so that there wasn't, they didn't have an expectation of what it was going to happen because they were new to the practice. So this is what you do. Or I have practices who just start with those high caries risk patients. You know who they are. I mean, Grace, you know who those kids are when they come in, right? And start with that kid and give them the form and let's dig down and try and figure out why that child has cavities and see if we can resolve those issues for them. So start with the risk assessment form. Everything flows from there and have one that's simple, not in the hygiene operatory. It's not an interview. It's them self-reporting. And so that's where I'd start. And then you can figure out in your practice, do you start with everybody or just high risk or whatever? And then eventually it develops to encompass everybody in the practice. But that's where I'd start.
Absolutely. I think it's a great idea. I mean, as from a pediatric standpoint perspective, a lot of us are always talking about prevention. And we always had, discussions about diet and obviously home care with our patients, especially that were in the severe category. And I had these little magnets with red light, yellow light, green light, like foods. And so it was like a picture of, put this on your refrigerator so that the kids can see, okay, I shouldn't be eating this or this I can eat plenty of, etc. And I think that conversation is really important, even if it's a brief conversation. And I love the fact that, like you said, having them fill out a form and self-assessment because it forces them to really think about it. When they're asked to fill out a form and answer, they're forced to really think about what they're eating, what they're doing. And sometimes, patients have the intake forms in advance. They can download it off the website or they're getting emailed. So they can do it on their own time before even walking into the practice. But I think that that's such a really important part of the dental visit. And like you said, it's often not compensated, right? Like it's not like we're getting paid by insurance for that type of work, but it's so imperative. And I think maybe that's why dentists don't do it because they're not getting paid for it.
Right. And I mean, practices cost money just to turn the lights on, open that door every day, so we all have overhead. We're all sensitive to the fact that, you have to generate revenue to have a business to help people, right? But I think that when I got to the point where I had the patient self-report their risk factors, that was a game changer. Like if you've ever walked in, I would obviously treat some children, but I'm mostly adults in my practice, but I walk into a patient and look at, oh, gee, it looks like you have a dry mouth. And the patient says, no, I don't. And the conversation's over. Like, I don't care what you say, how long you sit there, you are never going to convince somebody that they have something that they don't perceive that they have.
Right.
Versus when you walk, when you walk into the operatory and I say, oh, I see that I'm looking at your risk assessment form and I see that you say that you have a dry mouth. Oh yeah, doctor, I have this dry mouth. It's a whole different conversation. And, and now it's almost, there's the expectation of like, okay, doc, I've told you I got a dry mouth. Like, what are we going to do about it? Right. So it kind of leads to there. And that just literally changed the conversations. And patients are very good at self-identifying and self-reporting their risk factors. And it opens the door for a whole different conversation that you can be successful at.
I love that. Now, many of our listeners that are currently listening are dentists, hygienists, and obviously our community is moms, right? Mommy dentists.
Uh-huh. Right.
And a lot of them own their own business. And then also our other listeners are, I would say, consist of their spouses, their family members. So we have a whole slew of different types of dentists listening in, but the majority are mothers. What
Mm-hmm.
parallels do you see between nurturing a family and nurturing long-term patient health, especially when it comes to disease prevention?
Grace, that's a loaded question. And it's a dangerous territory to get into, right? I love moms. I have one myself, right? And my wife is a mom. I was a single dad for a lot of years as my own children were growing up, and I was basically a super mom. So if there's anybody out there that is like a single mom, and I have a daughter who's a single mom, and my, I appreciate what it takes. At the time, I was trying to build a practice, build a company. I was, taking my kids to and from school, doing cooking dinners, helping with homework, doing laundry at night, getting to bed at midnight, getting up at 5 to start this whole process. And it was like I was on this treadmill, sleep
Yeah,
deprived for years. And so it's like,
hard.
but I think that moms have a maternal nature and, they want to protect their children and they want to prevent them from being injured. I mean, that's kind of in our household, we laugh about that because as a dads have a whole different experience, right? I mean, they do in terms of their relationship with the child, and
Yeah,
children need both.
yeah.
But moms are like, oh, they want to protect somebody. Don't do that. I don't want you to get hurt. And the dads are, yeah, let them go give it a go. They'll get hurt, but it's not going to be fatal. And then they'll learn not to do that again, right? Like experience is a great teacher. And I think, I as a dad had more of that approach
Mhm.
as a person. It's like, yeah, I give it a go. And, once, the fire's hot. When you burn your finger one time, you won't touch it again. Whereas the mom would be like, oh, don't get near the fire kind of thing. And so
Yeah.
I think that moms generally have this nurturing capacity with nurturing a family, with nurturing their children, to protect them. And I think that carries over into a practice. Women make amazing physicians and healthcare workers and dentists because they have that, I think, for the most part, built-in caring, nurturing nature. And so, the whole caries risk assessment is about protecting your patients, preventing them, truly preventing this disease, preventing them from having those experiences, preventing the, pain and suffering that comes and the shame and stuff that comes with it. I know that probably sounds very sexist and
Pretty
we,
true.
I mean, there's just, I don't know how we got to this point in our world, but, we can't define what a woman is, but, I clearly in my mind, I think there are differences between men and women and there's, I see that and it's wonderful.
I agree. I totally agree. And I think that there are always, different outliers in roles and responsibilities. And it just depends on what you need to do for the child in the current situation that you're in. And I think that women, more and more women are becoming dentists as dental
Hmm.
schools are graduating 50% or more women
Yeah.
now. And so
Yeah.
it's interesting to me to see how the face, I guess, of dentistry in the dentist role has become a 50-50 split between men and women. And I think it's amazing because, again, Dr. Kim, we could have a whole nother
Oh
conversation on
yeah.
this.
Oh yeah.
And,
That's another topic for a
it's like
podcast.
another topic right here. We're birthing all these new topics on episodes, but you having done both roles, you firsthand experience, you can speak to it. And when you're doing both roles, whether you're a man or a woman, whether you're a dad or a mom, whatever, or I would call it the primary caregiver, right? If
Hmm.
you are in the position of filling that role as the primary caregiver,
Yeah.
yes, it is a lot of sleepless nights and a lot going on at once. And therefore, I wanted to bring on this next question about work-life balance and business sustainability because we cover a lot of that on our podcast. And I know that you've had to create work-life balance and you're a serial entrepreneur. How did you manage doing that? And then how does embracing preventative care, because now your whole passion is about prevention and protecting the patient, and your product, the carie-free product, it's not just a product, it's a protocol. You created this whole protocol to protect your patient, provide better outcomes, and then by doing that, how does this affect practice profitability?
Okay,
There's a lot of
there's
questions
a
in
lot of
here.
questions there, and let me start with the first one on work-life balance. It's a myth. It absolutely does not exist. I like to think in two thought processes here. Number one is there's it's appropriate balance. So like I would tell you that we all, God, there's this pressure that we've got to have this perfect life. And you look on Instagram or on Facebook and, oh, I get up at 7 in the morning and I have this perfect meal and I go for a jog and then I come back and I take my kids to school and then I work for 3 hours and then I have this healthy lunch and I meet with my friends and then I go back to work for 3 hours and then I go to the gym and then I pick up my kids from school and their soccer practice and then I take them here and then I go home and have the perfect dinner and then we engage and interact with our children and we tuck them in and they have this perfect balance in life. That is crap. That doesn't exist.
Amen.
That is not the real world. But people want you to believe that that's what my life looks like. It's smoke and mirrors. It doesn't happen. And I think that we need to think more in terms of we'd be a lot happier if we think in terms of appropriate balance. And if you're trying to build a company, trying to build a practice, and you've got two children at home, whether you're married or a single mom or a single dad, you're not going to have that kind of life. You need to put in the hours to make that happen. And if you got a practice and you're also trying to build a company, which, I was doing at the time, there is no ideal balance in it. But if you want to accomplish those things and also make sure your children are being attended to and that they're getting what they need, or your family or your spouse and the other people in your life, yeah, it's a struggle. But that's a period of time. And the second, I think, thought process I would give to you is that life is seasonal. It has seasons. Like, and certainly if you have children, you can identify that when they're less than 5 years old, that's a whole different experience and requires much more attention than when they're in grade school. And then when they're in junior high, that's a different experience. It requires less attention well, hopefully less attention because they can, they're responsible for their own homework. They can make their bed. They can dress themselves. They can bathe themselves. They can, they can get breakfast on their own if they have to, or, they're
Yeah.
able to like take care of themselves to a degree. And then when they're in high school or when they leave and go away to college, your life is different again. And so I think it's important to see yourself in seasons. And it's okay that this is the season. Yeah, my life is going to be out of that perfect balance during that season because I'm trying to build a practice. I'm trying to nurture and raise young children. But once they're in high school, my practice is going to be more established. I'll have more time for myself personally to invest in my friendships and in my community, or volunteer work, or working out, or hobbies, or whatever that happens to be. And
Mhm.
then as you get through that and they're off to college and they're out of college and your house is now paid for, and now maybe you're cutting back on your workload and your work hours. And you have this season where you have a lot more time for yourself individually to do those things or devote to your relationships and what have you. So it's not that your life was out of balance when you were in your 20s. It was the appropriate balance. That was the season of being
Mhm.
in your 20s. And if
Yeah.
you don't pay those dues, you don't get the benefit down the road when you're 50 or 60 or now in your 70s
Mhm.
of enjoying the fruits of those labors. So I hate when people get caught up in this, how do I have this perfect life balance? And social media, I think, helps put that pressure on us to like, oh, we
Mm,
got to have this or we got to do this. You're probably inappropriate balance and think about it as the different seasons of your life. I want to share one more thing that John Coyce said to
absolutely.
me, which really resonated for me. John said, you know, wherever I'm at, whether it's at home, at work, I'm, in front of an audience, wherever I'm at, I try to be fully present when I'm there.
Mm,
And I think that's really important that if you're home, you're home. If you're with your children, they have your attention. If you're
mm,
at work, it's appropriate for you to dedicate your attention to your patients. Or,
absolutely.
wherever you happen to be, just try and be fully present where you're there.
Well, I love all that input because it is very true and it rings so true. And our listeners are probably all nodding in agreement. And if you're in the thick of things, there is a light at the end of the tunnel
Yeah.
here.
I mean, it is like I'd love to have my 35-year-old body back, but I do not want to be 35 again, right? I mean, I don't want to go through that. I went through it once. That was, I did it, been there, done that, but I would like to, and actually I had a patient say, Kim, how old are you now? And I said, I'm like 60 and she was like, there's going to a day you're going to wake up and wish you had your, 60-year-old body back. And I was like, oh yeah. Right now I'd like to have my 60-year-old body back. So I think it's being able
Oh,
to appreciate where you're at in your life. Yeah.
absolutely. And you mentioned like social media kind of get throws us for a loop. And the days with when there was no social media, it was simpler.
Oh yeah. Yeah, right. I didn't have to look at everybody else, trying to convince me they had this perfect life
Right.
and what they were having for dinner.
I
So
know.
to make me feel worse about my own life. Yeah.
Oh, well, I think that that's what, ha like, again, another topic for another day. But I wanted to touch back on CariFree because I really want our listeners to understand. Well, we understand why you made it and what your
Yeah.
purpose was, but what does CariFree do and what is the protocol?
Yeah. So actually, let me back up for a second because there was a question you asked that I want to circle back and address, and that was, what does it do to practice profitability?
Hmm.
And this has been the elephant in the room from the day I started introducing this whole concept. And I even had a patient say, Doc, if this really works and I stop getting cavities, aren't you putting yourself out of business? And at the time I thought, yeah, I am. And that's my goal. And I want to retire and I want to go fishing and I want to enjoy that season of my life, right? I want to get to that season.
Absolutely.
And ironically, it was Bob Barkley back in the 70s this now I'm dating myself, but who said patients don't start buying dentistry until they stop getting cavities. And that it was just nonsensical to me as a dental student. He died, I think, in 1977. And I was in dental school and I heard that and I'm like, what the hell is this guy talking about? Like, that doesn't make any sense at all. Like, they quit getting cavities. Why would they buy dentistry if they don't have any cavities? And the thing that happened in my practice I was several years into this and I had the patient. I always like patient examples because this was my epiphany. This gal Bernice had been a patient of mine for forever. She was in her 80s. When I first saw her, she was missing, 29, 30, and 31. And I proposed a 5-unit bridge. And, every year she declined. And, that went on for years. And finally got to the point where I didn't even mention it. Right. And she was in her 80s and she'd always had cavities. And I
Hmm.
got her onto the CariFree, my protocol, and she was decay free for like 2 years. And she goes,
Yeah.
Dr. Kutsch, is it too late for me to get that 5-unit bridge? And I looked at her, I mean, I thought, why in the world would you want that now, right? And I asked her that. And it was my out loud voice, and she goes, oh, well, now I know that it's going to last. And it was
Oh,
like, for me, that was the light went on. It's like, oh
yeah.
my gosh, this is what Bob Barkley was saying. It's like they have the confidence after they stop getting decay and they feel in control of their health. And so this is the thing, that happened in my practice. Ironically, I help patients get decay free, and then I spent the last 20 years of my practice
Mm.
primarily doing large restorative cases, cosmetic cases on patients that want, now that they were decay free, now I want the beautiful smile that I've always dreamed about. And I literally spent the last half of my career doing large restorative cases, and I made more money. So ironically, I was trying to create this minimally invasive protocol to treat it like a disease, but on the other end of that, the outcome was they wanted this, elective restorative work, and I ended up making, if you want to do that kind of work, get your patient decay free. That's the advice I would give you, because they don't start buying dentistry until they stop getting cavities.
That is
That's
such a great example and a great story
uh,
to put into perspective what what that professor had told you. And I think that's such a really fascinating story, and this example of this woman who, like you said, wanted that bridge after she knew it would be stable. Like that is pretty amazing.
well, when
Really.
she said that, I get that. Like
Yeah.
suddenly I got it. And then it's
Yeah.
like, and so all those pieces fit into place. And thankfully I've been studying with John Coyce, 25 years ago, and I
Mm.
was prepared to do large restorative cases and have predictable outcomes. And it was very rewarding and enjoying to be able to help people do that. But yeah, if you want to get big, this seems just like, if you want to get busier, in your practice, help patients become decay free.
I
Right. And
love
so
that.
you're not putting yourself, I guarantee you're not putting yourself out of business. You're actually helping patients in ways that are life changing and very rewarding.
I love that. What's the biggest myth you still hear in dentistry about cavities and prevention that makes you want to pull your hair out?
I still have some hair left, but
You.
I think, Grace, the thing that still drives me nuts is that we, as a profession, have this belief that we can drill our way out of this. Like we have a decay epidemic in this country driven by pharmaceuticals and diet. I mean, it's like 70% of Americans, all the way down to age 6 months, take at least one prescription medication every day. And we know that the number one side effect of that is dry mouth. We know Americans eat on average 23 teaspoons of sugar per day. I mean, we're off the charts on both of those things.
Yeah.
Fluoride, I mean, forget fluoride. It couldn't even begin to keep up with that. When I was in dental school, they told me to plan a 20-year career because of fluoride. In the by 1990, there would be no tooth decay. And now,
Mm,
I mean, Grace, you're a pediatric dentist. Look
yeah.
at the tooth decay you
No.
see come into your office, and it's like it's worse today than when I started practice, like 40
It
some
is.
years ago, right? It's worse today, and it's because of those risk factors. And so I think this mentality that we can manage this disease with a brush and a piece of string and a little bit of
Mhm.
fluoride and a drill, if that worked, it would have worked. And I got to tell you, it hadn't become close to working. We
Mm.
need to stop, back up, and ask, why does this patient have cavities? If I can get that answer correct, I have an opportunity to help this person become decay free and become decay free for life. So I think just that one mentality we still have in the profession that drives me nuts.
Yeah, well, I'm glad that you answered that and that you've made it very clear about that myth. And I think that people are going to listen and contemplate that for sure and think about, okay, what can I do to not just take better care of my patients, but really eradicate caries as best as I possibly can. Obviously, we can't, short of being it's going to someone's house. I mean, I used to have moms who would call me on my cell phone with the kid in the bathroom, and or if I wasn't available, they would pretend like they were calling me, literally in the bathroom with you guys brushing your teeth. Um,
Okay.
and my last question to you before I let you
Uh-huh.
go, which now I need to modify this question because
Okay.
earlier on in the episode you said that there really is no such thing as balance. And it depends on the season of life. In your current season in your life, I hope that you're doing more fishing. And I hope that you're
Oh yeah.
doing more
Oh yeah.
relaxing.
Oh yeah. I'm having so much fun. I'm having, it's two things. I'm having more fun right now than I've ever had in my entire life. I absolutely love my life. And number two, I'm also doing the best work in my entire life. So like what, I mean, I'm knee deep in a lot of new products and a lot of new things that we're creating to help people with, oral diseases. And I'm so excited about that. And it's really rewarding to be able to make life-changing experience and be able to help people on that level. So that's on one hand, my work has never been more fulfilling. And number two, I've never had this much fun. So I'm doing the fishing. I paint. That's one of my hobbies. Yeah, I'm enjoying my children and grandchildren. It's like it's a great season of life. So I'm absolutely enjoying it.
I'm
Yeah.
so happy for you, and that makes me really happy that you're really living to the fullest and getting all the things that you want. And so
Oh, thank
kudos to
you.
you.
Yeah.
Now, before I pop off, is there anything that you'd like to tell our listeners and maybe tell them how to obtain CariFree, like how to order it, where
Sure.
to get it from?
Yeah. So one last comment I would say, Grace, is design your life. Like you're the person in charge of your life. So maybe you can't create, you're in those different seasons, but design it. Design it so that you create the life that you want. Right? You're in charge and everybody's capable of that. We're the ones in charge of our schedule. We're the ones in charge of our
Mhm.
life. And so create a plan for yourself and goals and lay out what your perfect life would look like and then pursue that, right?
Absolutely.
How to get carry free in your practice, how to learn. And my team at Carry Free has trained, oh gosh, probably over 10,000 dental practices. We have more experience at training people on how to
Wow.
implement risk assessment based care into your practice. And those are free. They do webinars to help, lunch and learns. They do all of that. It's all for free. But if they just go on the website at caryfree.com. If you're a dental professional, go on to
Mhm.
caryfreepro.com. So that's CARIFREE pro.com and go on and you can either purchase products there or if you want more help in terms of how do I implement it, how do I integrate the risk assessment forms, how do I help, get the communication skills from my team and myself, we're there to help you and provide
Thank
support and
you.
assist you. And me personally, if you get stuck on a patient, contact me. If there's any way I can be a resource to you and help you provide better care, that's what my life is all about.
Thank you. Thank you so much. And for all of our listeners, you know where to go. And if you're looking, again, our listeners, we just came off of our large conference last 2 weeks ago in Los Angeles, and our next year's conference is in Washington, D.C. So tickets are available on our website at mommydibs.com. And we will see you next time. Thanks for listening. Thank you so much, Dr. Kim.
Thank you, Grace. And I got to tell you, I love your group.
Thank
Absolutely love you guys.
you.
So bless you all, and I hope you all have a great week.
Thank you so much. And I hope your daughter joins us.
She should, yes, absolutely.
Okay, well,
All right,
we'll
Grace.
reach out.